Choices. We make hundreds, if not thousands, every single day of our lives, often without even realizing we're making them. As an experiment once, I thought I'd write down all my choices in a notebook, but I couldn't decide which notebook to use. Luckily, experience has taught us how to make quick, automatic, snappy judgments. If we didn't have this ability, we'd be standing around in supermarket aisles all day long deciding between fabric softeners. There's more to life. But there are some choices that we really do take far too lightheartedly, and we should be taking them much more seriously. I'm talking about how we choose to live our lives, our lifestyle. How we choose to live can have a massive impact on our health, not just now, but in years to come. So it's essential to make the best choices we can. We all know, or we should all know, I think, that smoking is bad for us. A healthy, balanced diet is really good for us. Fresh air, adequate sleep, exercise, they're all really good for us too. However, when it comes to our health, very few of us make enough positive choices. This is a real problem. And actually, what I find is it's a problem that can cause serious issues for the family, for the individual themselves. Because it's essential that we actually think about what we're doing and what we're deciding to do with our bodies and with our minds. I feel very passionate when I talk about this topic because it means a lot to me. I find it very, very important. When it comes to life, life is always busy. Life is always stressful. There's always deadlines. But when it comes to health, good health is not a given. Good health is not guaranteed. We're not owed good health. Yet, so many of us do prioritize our body and our minds. We put family, friends, socializing, and work above ourselves. You'll hear me talking about chronic diseases quite a lot. Chronic diseases are also called non-communicable diseases. And they're essentially illnesses that develop over a prolonged period of time. And they're not transmittable, so they're not infectious diseases that can be passed from one person to another. They include things like heart disease, lung disease, type 2 diabetes, obesity, some cancers. And they are very common. And I'm sure most of us will know someone that suffers from one or more of these illnesses, or even may have personal experience of them. These illnesses are the greatest cause of death and disability worldwide. They kill 36 million people a year. That's 36 million out of 57 million. Or if you're a percentages kind of person like me, that's 63% of global deaths. So that's including developing and developing countries. The really interesting thing about them is that they're largely preventable. Now, I'm not saying they are in every case. They're not in every case. However, the vast majority are due to how we've chosen to live our lives. But there is good news. And that is, by taking control and realizing that we actually have a degree of power, we can make huge changes. So whenever I talk about this topic, I think back to my first week as a junior doctor. Because although we know what to do, why don't we do all the things that we know are so good for us? So when I was working as my first week as a junior doctor in a hospital in Glasgow, well, I think I was a bit deluded back then, like most junior doctors are. And I think I just assumed that because I was now a doctor, people would listen to my advice and do what I said. No. Usually I was asked how old I was, and was I sure I'd actually done a medical degree? You look very young. You sure you know what you're doing? This was a common, though slightly embarrassing question I eventually got used to. When I finished my GP training, as it's known in the UK, in the US it's called family medicine, thankfully I looked a bit older, so that really helped. But generally my lifestyle advice was still not taken, and this was really frustrating. When I realized why it wasn't taken, it was as if a light bulb went off in my head. I'm going to tell you what I realized. Your opinion of me is probably going to drastically change once you hear it because it's so obvious. and you probably all know it already. But here goes. People don't do what they're told to do. It has to come from within. That's it. That is so obvious. I think, in my defense, on some level, I maybe knew this already, but it wasn't until that point that the implications of this really hit me. So that's when I decided to train to become a coach, so I could better understand human behaviours and help people make changes. But finding my own journey through life and challenging myself hasn't been easy. So when my husband and I decided to quit our London jobs, pack up our flat, put everything in storage, and buy a one-way ticket to our travelling adventure, people were a bit dubious. If I'm honest, they were really concerned, really concerned, and mainly about our mental health. But we knew what we were doing, and we emerged about a year later, largely unscathed, possibly not as wise as we thought we'd be after all that, but having learned so much and got so many new experiences. I'm telling you this because it was only by allowing myself the opportunity to step outside of my box and observe myself from the outside that I could really reevaluate my life. And I'm not telling anyone to go home after this, draft a resignation letter and find their suitcase. No, please don't do that. It doesn't have to be as extreme as that, and one size doesn't fit all. But what I am saying is find your own way of taking a look at your life and making the changes you need to make. Give yourself the gift of reflection, because when it comes to your health, the time for change is today. It's not tomorrow, it's not next year. I find this a fascinating concept. We know the most about health we've ever known, and yet we're the unhealthiest we've ever been. Infections like smallpox and plague, they've been replaced by things like heart disease and lung disease, other illnesses I mentioned. And of course, in many parts of the world, TB and cholera are rampant. But what we are seeing is a big change in the global pattern. We're seeing a big change in the shift of diseases on a global scale, and we're seeing a lot more chronic disease in developing countries. Making changes isn't easy. I know this myself. It's much more convenient just to carry on as we are, rather than try and identify the underlying issues, challenge them, and change them. As humans, we prefer to cross bridges when we get to them, rather than thinking ahead and anticipating the potential problems that might develop. So we eat rubbish. We don't exercise. We update our social media from the comfort of our own bed when we should really be fast asleep. And this is a real problem. This isn't proactive living. This is passive living. And all these choices, combined with many others, increase our risks of developing these chronic diseases that we've been talking about today. So although we know how to make changes and what we need to do, we just don't do it. If we do happen to develop a problem, we prefer to take some medication to help us deal with it. And not unusually, we have to take another pill to deal with the side effects of the first pill. Now, I'm not discounting that there are some truly wonderful medicines out there. There really are. Some are life-saving. But what I am saying is that prevention is always better than cure. So I'm wondering if you could ask yourselves if you're taking enough responsibility for your health, and could you do more? Now, I've spoken a lot about the physical implications of the choices we make, but there are other equally important implications too. For example, our mental health and our emotional well-being. It's very well known that better physical health results in better emotional health and better mental health. All of us are interlinked. You know, we're not separate bits. We're all one. And sometimes realizing this can have a major impact on our lives. It can be truly life-changing. But sometimes it's really difficult when you're in the situation to see that. Sometimes you need someone external to provide that perspective for you. And that can be a friend, a relative, or just someone you know, you trust, and you feel safe with. So a 32-year-old diabetic may not be going to see her doctor because she's concerned about her diabetes. No, she might be going to see her doctor because she's a 32-year-old single mother of two. she's struggling at home, she's not coping, she's feeling quite down in the dumps. And every night she sits in front of the TV and she comfort eats. And this is how she copes. And this in turn has a negative effect on her diabetes, which has a negative effect on her physically, mentally, emotionally. But if we only choose to see what's on the surface rather than delving a bit deeper, we will miss a wonderful opportunity to get to know this person and actually work out what's really going on in her life. Because without working that out, it's very difficult to change and tackle the embedded behaviours that form part of her habits. The best doctor gives the least medicines. This is one of my favourite quotes. And this is what Benjamin Franklin said in the 1700s. I wonder if today, in 2015, we share this outlook, or have we lost sight of what really matters? Have we replaced the basics of healthy living with the complexities of modern-day life? If we're really going to change the direction we're headed in, as a society, we need to realise that we have the power to make positive choices. And we need to make those choices, not because someone tells us to make them, but because we're truly convinced that they're the only way to keep moving forwards and start gaining momentum. So please ask yourselves again, are you taking enough responsibility for your health? And can you do more? Thank you.